So we just learned a lot on the last panel, some really profound and important information. And you might be wondering, okay, I've taken all that in, and now how do I talk about that as a health professional? How do I, in my day-to-day work, as I talk to my friends and my family about climate change, how do I convey a little bit of what I just learned and send that powerful message on? So we are going to share that. We're going to tell you how to start approaching that. There's also a workshop later today that will help us do that further. So we are first going to hear from John Kotcher, who is a research associate professor at George Mason University's Center for Climate Change Communication, which, as you know, this is the consortium's home. And John is going to present the body of evidence that tells us that talking about the fossil fuel industry as health professionals does not, in fact, diminish credibility or turn people off from engaging in climate change. In fact, it does the opposite. Spoiler alert. And then Nick and Rob are fantastic communications duo from Burness Strategies, and Rob is our strategic communications director at the consortium. And Nick has been working with us since the consortium started, and we're just, always thrilled to have him. And many of you have been trained by Nick before. And then Abby is the ED of Healthy Climate Wisconsin. And Abby's going to share what it's been like for them to actually use this messaging as a group and what the impact has been on their organizing of health professionals. So with that, I am going to turn it over to John.
Thanks, Bev. Well, first off, I just want to say thank you for having me here, and just what an honor it is to be sharing some of what we've learned in our research. I'll probably be summarizing maybe 6 or 7 years of research in about 15 minutes, but really looking forward to sharing this with you today. And so a couple of folks have mentioned this already earlier in the day, but the Center for Climate Change Communication at George Mason University is the home of the Medical Society Consortium, and we consider ourselves a think and do tank. So on the think side of things, we've got folks like me who do communication research to identify public engagement opportunities to improve support for actions like transition to clean energy. And so this might involve doing experiments to identify promising message strategies, but also importantly, we do surveys of public opinion to look at people's beliefs, attitudes, and behaviors with respect to the issue. And importantly, we look for trusted sources of information, because on the do side of the think and do tank, we try to activate those trusted voices and provide training and support to help them apply the most state-of-the-art science of climate change communication. And so that's really what we're here to do today. And as Ed mentioned this morning, one of the superpowers that you all have is your trusted status when it comes to a whole variety of issues, but as I'll show you in a minute, climate change as well. But don't take our words for it. Let's take a look at the data. Survey says, any Family Feud fans out in the audience? I can't help, because it always reminds me of Family Feud whenever I look at this chart. But so this is data from our nationally representative surveys that we conduct twice a year with the Yale Program on Climate Change Communication. And as you'll see, one of the most highly trusted sources of information here in the US are people's primary care doctors. Now, retrospect, I probably should have highlighted the American Medical Association. They're also in there, also very highly trusted, although perhaps not quite as trusted as people's primary care doctors, because as you might expect, people have a personal relationship with their own doctor. And so it makes sense that they would trust them perhaps a little bit more. But two key things I really want you to focus in on this slide here is also check out who's at the bottom of the list in terms of trusted sources, right? So like Ed said, you have a competitive advantage against the fossil fuel industry when it comes to trust. The other key thing I'd like you to draw your attention to here is look at the right-hand side of the graph. Look at how high primary care doctors are for Republicans. So what this suggests, and as we'll see in some of the research in a moment, healthcare professionals have a unique opportunity to depolarize an issue like climate change here in the US. Now, you might notice that primary care doctors are a little bit lower for liberal Democrats. Don't fret about that, because liberal Democrats tend to place a high degree of trust in a lot of these sources. So it's not that they distrust doctors. These are just relative rankings. They trust a lot of those sources, okay? So don't feel like you can't talk to liberal Democrats, because you can. Okay. So let's take a look at people's perceptions of the health threat of climate change and fossil fuels. So this is data from 2018, also from our nationally representative surveys. We're not even talking about climate change yet, but when we ask people, do you think air pollution from burning fossil fuels harms people's health? About 7 out of 10 people say yes. But then when we follow that up with an open-ended question and ask them, okay, what are some of the ways that air pollution from fossil fuels harms people's health? They struggle to think up of an answer. And as you'll see, oh wait, I think we missed a slide here. Oh, sorry. So there's another slide in the slide deck. This is showing which communities people think are most at risk. But the slide that's not shown here shows a very similar story in that in terms of all the myriad ways in which air pollution can harm our health, the most common answer offered by about 3 out of 10 Americans are general references to respiratory problems. They say things like breathing problems. Even fewer people are able to name specific health conditions like asthma or lung cancer. And only about 1% of people are able to offer up answers like neurological problems. So there's a growing amount of evidence that air pollution harms not just respiratory health, but a whole host of other systems in our body. So when we ask a similar question about who's most likely to be harmed by air pollution from burning fossil fuels, people also are in a similar place. They struggle to think up of who's most vulnerable or who's most likely to experience these problems. And so one that I'll just draw your attention to here is children and young people, because based on this data, we started to get curious. Okay, well, what would happen if we actually informed people about some of this stuff? And so a number of years ago, we conducted a message experiment where we provided people with information about the myriad ways in which fossil fuels, air pollution from burning fossil fuels, again, not even bringing climate change into the conversation yet, harms people's health. And we found that that information increases their support for building more clean energy and reduces their support for building more fossil fuel related energy. We also had the folks engage in a message ranking exercise. And what we found is that the one piece of information that was most concerning to them was that information about neurological harm to children. And this was true not just in Democrats, but also Republicans as well. Okay, so broadening it to climate change, we also conducted another study around the same time that took information from about the 8 different pathways that climate change harms people's health. And this was information taken from the USGCRP's National Climate Assessment. And so with the exception, I think, for hunger and malnutrition, I think that was our addition. But at any rate, we had people read brief statements of about these different harm pathways, about 100 words apiece. And they also included information about who's most likely to be harmed through these pathways. And what we found is that it increased people's cognitive and affective engagement with the issue. as my mentor, Ed Maybach, frequently likes to say, it transformed climate change from a plants, penguins, and polar bears problem to a human problem. It decreased that psychological distance that people often feel with an abstract issue like climate change and brought it into the present in a much more concrete way. And so this research really formed the basis for the consortium's 2017 publication, Medical Alert, which was aimed at mobilizing the health professional community to help them raise awareness about the myriad ways in which climate change is harming our health. But as we know from good risk communication research, simply telling people about the threats to their health is not enough. You also have to give them a sense of hope and a sense of agency that something can be done to address those threats. And so in 2022, the consortium also released this other report, The Medical Promise of Climate Solutions, to outline some of the ways in which climate change solutions can benefit people's health. And one of the key messages from this report was that oftentimes when we talk about climate policy and its benefits in climatic terms, much of those benefits are diffuse and spread across the world, and they take many years to accrue simply because of the long-lived nature of CO2 in our atmosphere. But when we talk about the health benefits, it transforms the conversation into something much more locally focused and much more immediate in terms of its impact. So for example, we know that shuttering fossil fuel power plants in communities provides rapid improvements to air quality in those communities. And so this was also, as you might expect, informed by message research that we had done. This was arguably one of our most ambitious studies that we've conducted to date. And what we did is here we developed a narrative about climate change and health that started with the health impacts. Again, we tested different variations of those health impacts, including the eight different categories in the NCA report. And then we had a discussion, a section about the policy solutions and the ways those can benefit people's health. I think we tested about 7 different types of policy solutions in that part of the narrative. And then we ended it with a call to action with different types of statements to enhance that call to action and increase people's likelihood to engage in advocacy, to ask their elected officials to take action to address climate change. And what we found there is that the most helpful information was simply affirming people's social norms, that many other people care about this and are already taking actions to support these kinds of solutions. And so one of the things that we found, we tested about 360 different message permutations with different combinations of these components. And what we found is that all types of information were helpful in terms of getting people to increase their likelihood to engage in advocacy, but it was the solutions information that was most influential. And again, this was equally true for Republicans as well as Democrats. Okay, last study. So earlier, Lisa mentioned this. This was our most recent study that was published late last year. We took that same general narrative, focusing on impacts, solutions, and a call to action, but this time we enhanced it by also including a component that specifically called out opponents to actually implementing action to address climate change. And so specifically, we called out in one condition, fossil fuel CEOs and their lobbyists. In another condition, we referenced some politicians without explicitly mentioning any particular party or any individual politicians. And then lastly, we also had a combined condition which talked about both of these types of opponents. And we compared this against our standard climate and health narrative, the impact solutions call to action, without any reference to opponents, as well as a no message condition. And what we found is that talking about the opponents, calling attention to the opponents, was really helpful in clarifying for people who was responsible for the problem. It sharpened things up. And another thing is, for as much time as we spend talking about fear or hope and the importance of striking a balance between those two emotions in climate change communication, turns out anger is another powerful emotion that can be a really helpful motivator in getting people to take action. And it's this type of messaging that really gets people upset and gets them going in a constructive way. But we were also concerned because understandably, some health professionals may feel uncomfortable taking a more antagonistic position like this. And so we also looked at not just how it affected people's engagement with the issue, but whether it affected people's trust in health professionals when they talked about the issue in this way. And what we found, surprisingly, was that actually calling attention to the opponents across all three different opponent conditions improved trust in health professionals relative to the control condition, as well as the standard message that excluded any reference to opponents to climate action. And again, this was true among Republicans as well as Democrats. And the other thing here is a lot of the effects were more pronounced among Republicans and independents compared to Democrats. Okay. And I know we're short on time, but basically the importance of talking about air pollution and climate change as a result of burning fossil fuels is that it transforms the way that people look at the issue. It makes it more personal for them. Talking about the solutions, again, brings the focus from far off in the future to here in the present in people's own communities. And then again, as I mentioned a moment ago, calling out the opposition brings into focus what's at stake and who's responsible and how specifically people can address the issue, that it's not just about reducing your own personal carbon footprint. You shouldn't feel ashamed or guilty about it, but that you should be directing your anger at those people, right? And then lastly, that it also has the potential to depolarize the issue. Okay. And if you'd like to learn more about our research, you can use that QR code to subscribe to our email list. And with that, I'll go ahead and hand it over to Nick and Rob. Thank you.
Thanks. That's fantastic. So I think what we want to do, Rob and I are going to talk about sort of how we take all of these great insights and then sort of layer them onto the messages that we've talked about that we can use as we're advocating in this work. So as we talk about this, there are a few best practices that we've talked about in past meetings, but we want to layer all these pieces together. So first, we always want to remember to tie our messages to what people have experienced. So we hear when we talk to folks this like simmering sense of things are unstable, things are changing, they're not predictable. And so that can be a really effective entry point. We want to lay out a positive vision for the future. One really important piece here is to just make sure we're really explicit about the connection between health and climate. Because what we've seen when we talk to groups about this is people don't necessarily make that connection, even though it's intuitive to all of us. But the good news is it's really readily accepted if you just say it. And so really important throughout this is not to leave that connection to be made for audiences on their own. We want to help people understand that some people are more impacted than others. The equity component of this is really important and surprisingly challenging for folks. Sometimes people hear global threat, and so it is somehow counterintuitive for some that some people would experience it more. So we want to be really intentional in how we're introducing this. As John just talked about, we want to make sure we're naming our opposition. I think when we don't, we leave space for people to fill in that sort of blank. And that's where they can start to think, am I the opposition? Is my behavior? Is the atmosphere? What is it? And so the more we can direct people, like John said, the more impactful we'll be. And then I think what's really powerful out of this research, and I'll just reiterate, like seeing this research was super helpful to me as I think about how we apply this to our work. Because I think, for lots of good reasons, there's been some concern about how hard do we go in this. And so this was deeply reassuring for me. I think naming that fossil fuel is the enemy of our health and our climate is just a really powerful way to talk about this. And just noting that from the research that John and team have done, sort of people see it more as a health threat than climate. So sort of we can ease people in by talking about the health impacts and then naming climate. So let's look at how this comes together. And there's a QR code at the end so you can go see a new guide on this. But we want to start with this shared aspiration message. What is it that we're all working towards? You know, if we have that common ground we're seeking, it's much easier to have that conversation about how we get there. So this is an example of what that can look like. It's really important, you know, communications, ground rule, starting with knowing who your audience is important. So each of you are going to adapt this in different ways. This is not to say this is the holy grail of messages, but a really helpful starting point. So after we get through the aspiration message of sort of aligning folks on where we're headed and tapping into our common values, we want to name the challenge. And so on each of these, you'll see the sort of the subheadline is that core message. And Rob is going to talk about how we weave all this together into a narrative. But that's sort of the summary in a nutshell. And then below it, we have a sample of how we talk about it. And I think what you see when you look at this is we're leading with fossil fuel air pollution and its impacts on health, and then the climate change it's causing. There are a lot of examples here. We're not encouraging you to always list every example because that's a very long conversation. But find the ones that are resonant for the audience you're talking to. So starting with this idea of how are we localizing and personalizing the impacts. We want to be very explicit, as you see in the sort of leads to more lung and heart disease, harm to the brain development of children. We want to tie it to health, like I said, very explicitly. And then this last paragraph is an example of how you can start to introduce the fact that climate change, the impacts of climate change are not equitable. And you'll see, again, there's a long list of folks who experience it. We're never going to be able to list everyone who is impacted disproportionately in a conversation. And so this is where understanding audiences can be helpful, understanding, you know, where they're entering this conversation. We see that people have different levels of how quickly they're willing to accept the idea that there are racial inequities in the health impacts of climate change, which is not to say we shy away from it, but sometimes we name, like John showed on that list of where are people starting of seeing these inequities. We name that what they kind of recognize already. It's much easier to then introduce the other inequities that exist. We want a solution message. And I think what's really important here is we point to action at all levels. I think when we overly focus on just the federal level, it can start to, like, you know, we all have feelings about how well our government's working on a federal level, but I think reminding folks that action happens at all levels is really key here. Naming the obstacle in here, and this is, I think, one of the big updates you see in this messaging is naming that big oil, fossil fuel CEOs are the obstacle to overcome. Giving people that sense of what is in the way is really critical. And then reminding that we want to talk about the immediate health benefits from these changes, that it's not 20 years in the future, it's now and 20 years in the future. So this is, I think, a really important sort of update in how we're talking about this. And we want to have this hope message. I just think this is really critical, and the guide that we have has more, but giving people a sense that this isn't pie in the sky, pointing to progress we've made, giving people a reason to think like, no, there's hope, we can do this, is really a powerful message in a time of cynicism and questions about the power of us to create change in our system. And so really just want to emphasize that the hope message we're talking about is not just, you know, someday I hope we're all happy and healthy and living in a perfect world. It is saying, I know there's hope we can do this because we've done things like this before. And to the point of sort of normalizing this, pointing to the fact that actually, no, people are with us. There's a sentiment and a narrative that, you know, this is a straggler movement maybe, but people are here. And that's an important part of this. So here's a QR code that goes to the guide on the Consortium website that goes a little bit deeper on some of these. And with that, I'm going to hand it over to Rob to talk about how it comes together a bit more.
Okay, so how did you feel after the previous panel finished? You're angry, you're mad, you're outraged, right? And did it make you feel like running out in the street and grabbing somebody and saying, I got to talk to you about this? First of all, on the before I get into the follow-up to that, it's good to have a headline. It's good, you know, when Ed and I worked on the anti-tobacco campaign called Truth. It was to get kids not to initiate tobacco use. And our headline was, their brand is lies, our brand is truth. And it was a great entry point into a discussion with teenagers about like what they really cared about. And then we could go on from there. So our headline is that fossil fuel pollution is the enemy of our health and our climate. Because it's a complicated topic. It's good to have a headline like that to say, and now I'm going to talk to you. But it reminds me that what I wanted to say is that how you felt and maybe you wanted to get out there and talk to somebody is what we're really involved in here. We're involved in influence, in power to influence people's behavior. It's not about educating people. Educating is maybe part of it, but we're about changing people's behavior. We're about making them change. And all of the research that John and the team have done for us is to give us a third superpower. The first superpower has been talked about a lot by Ed and John, and it's probably the most important one, and that is trust. That you are trusted is probably the super duper superpower. But the second superpower is truth. That you're not just saying something to influence people because you personally want to influence them. You're delivering, you're revealing truth. The truth about what pollution is doing, the truth about what is happening to our climate, and the truth about what big oil is doing to stop progress. That's a tremendous superpower to have truth on your side. But the third superpower that is this power to deliver those truths in an effective way. And that's what the communication research that is giving us, is the power to deliver that truth as effectively as we can. So what Nick has gone through is the messaging, and I just want to add a couple of points to, well, what does it mean to tell, we can do the slide now, to tell the big story, to tell the narrative. Oh, I have to do this. So which button? Let's try that one. It's right. I've only done this. This is the second talk I've ever given. And so here, just read through this sample narrative. I'll actually read it to you. We all want to live in a safe, healthy, stable, stable communities, but as a I know that fossil fuel pollution is harming our health and causing climate change. That threatens our communities and our health. We are seeing more smog and air pollution, stronger storms and hotter days. Fortunately, we've also seen that a clean energy future with cleaner air and water and healthier people is possible. There's widespread and growing support for this transition, and we've seen communities all around the country making it a reality. However, big oil companies and their lobbyists are undermining progress by deceiving the public. We need, I'd say we can and need to act together to overcome the campaigns and misinformation of big oil companies if we want to improve the health of people and the climate. Okay, that's not the story you're going to read verbatim. You don't have to worry about taking all this down. But it's an illustration of taking the messaging and putting it into a story. So what makes a good story if your aim is influence? Well, the metaphor I like to use is that if you're taking people on a ride from here to there, you can then say, okay, we're going to take a ride. You can put them on a commuter train and they go from here to there. And how interesting a story is a ride on a commuter train. What do people do on commuter trains? They don't even look out the window. They just look at their newspaper or whatever. They look at their device. It's boring. So that's not a good story. The better story is a roller coaster ride. A roller coaster ride is something you're going to tell people about after you've done it. You're going to remember it. I will especially remember roller coaster rides because I'm scared of roller coasters. But be that as may, think about it that way. Now let's look at this story in terms of the roller coaster ride. You know, it starts as just a nice, positive, setting the stage story of shared values. We all love living in the Shire with Frodo and having second breakfast. That's the beginning. But we all love this, and now the but. So the roller coaster begins to go down. Fossil fuel pollution. Now we're telling that story of the harm that it's causing and the specifics that make the story stick. You don't want to just have harms. You want to tell people, give an image that they can hold on to right there. And it's personal. It's what you've experienced, that harm as a health professional. That will make it stick. So that's the roller coaster. And it reinforces, we have this shared concern now. We're together. Fortunately, and now fortunately, the roller coaster starts to go up again, is that we've seen that clean energy future in water and health, it's possible. Whee! There's that message is there's real hope. We can reach the mountain of doom. We can drop those darn rings into it and save the Shire. And beyond that, there's real and widespread support. We've got the Army, and we've got people coming, and who are those people that came over on the horses for over the hill to save the day in the second version of Lord? I don't know. Remember what they were, but it was great to see them. There were so many orcs. So we've got this support. We're growing, and we've got to have that support because there is opposition, and these are the people perpetrating that, and we got to overcome that opposition. So now it goes down again because there's opposition, but we've got to get busy. So what it leaves people with is not, that's great. We love what you guys are doing out there, so go ahead and fight your fight, right? Because that would just end the story as people are on our side, we're going to do it. But if there's nothing if there's nothing opposing us, if there's no challenge left, then it doesn't set up what is the end of all stories, which is the call to action. Whatever you're wanting people to do, whether it's vote or go to the hearing or write a letter or whatever that call to action is on our side, that setup of this story is to get to that call to action and have it responded to. Even moving people closer, if they're on that conservative side of just saying, well, I'm going to listen more to this anyway. That's progress. But they're doing something different. They're reading something more, or they're taking action. So that's, if I think I didn't have any, oh, I forgot to fix this, and I just went right on to it. So that's when we call out our villain that we need to overcome. And if we want, so we can prevail is the end, but we have to take action. You need to do something to do it. Sorry about not getting to this slide. You're probably wondering what I was talking about. So I think I'm done. Thank you. And now to Abby.
All right, I'm going to walk you through a little bit of how this has looked in Wisconsin, because we have been using some of these messages actually from the beginning of our health organizing group, Healthy Climate Wisconsin, also known as the Wisconsin Health Professionals for Climate Action. So here is just a look at one of our action alerts that we put out this summer. So we know there was a ton of EPA safeguards up for public comment, and we wanted as many of our health professionals as possible to be weighing in on those and providing expert testimony. And so, you know, believe it or not, I actually didn't know they were going to call attention to values and solutions. And I put all these frameworks together to kind of give you an idea of what that looks like. And so now I won't have to do that so much. But you see the value statement right away, where all Wisconsinites deserve clean air. We talk a little bit about race in there because we know that there are different communities experiencing more impact. So we want to call to attention that not all communities have that clean air right now in our state, and that we have a solution. We can advance our nation's bedrock environmental laws, such as the Clean Air Act. And we call attention to the Clean Air Act a lot because it's an example of how we've overcome this before, and so we can do so again. And then you have our villain statement down below. So you see fossil fuel corporations are launching lobbying and media campaigns against these protections. So it's important that they hear from real Wisconsinites and health professionals. We all have a story to tell. And then there's the action tool down below. We specifically use the term corporations a lot because in Wisconsin research studies, we know that they are the least liked and the least trusted. So if you have messaging from your state, try to use that wording if you can. And so the response was really phenomenal. I'll dive into that a little bit more. We had to make a whole ebook to celebrate our team for all their hard work. I also wanted to call attention that in some of our celebrations, we also continue to use this narrative because the goal is to get our health professionals to see their agency and then want to take action again and again and again. So we don't just use this in our call to actions, we also talk about how we overcame together and can continue to do so. So here's a little bit of some of those responses. We had over 360 comments just from Wisconsin health professionals. Many of those health professionals also testified. A lot of them became new members, so they got hooked and wanted to keep doing it. We had them go to medical societies, and we had a lot of different health organizations within our state sign on to our organizational letter talking about the benefits that could come to health in our state, and coming together using these messages is possible. It doesn't scare away our partners. And we also found not only were health professionals doing these action alerts, but they took the time to pull out their computers, send an email my way, and say, I want to do more. So they didn't stop there. They were very motivated to keep going. Many of them ended up going to this huge press push. So you'll see a lot of press conferences and op-eds and articles here. Our EPA efforts were featured very widely across print, TV, and radio. So I'm going to call attention to kind of how that messaging was used by some of our health professionals in print. So this is an op-ed by Dr. Joel Charles. You can't see the top of the op-ed on the screen here. I couldn't fit it all, but you can see how he really frames some of these health impacts and solutions in villain that was talked about earlier. So in this purple, you see him talking about the fossil fuel damages to our health that we see daily in our state. It really makes it local. It makes it prominent. There was some talk about climate change and populations disproportionately harmed on top of this. Like I said, you can't see the whole article. So then he calls back to that connection to climate change again. And then in the orange, you see the solution. So right now we have better, cleaner, and cheaper options. And the EPA has an opportunity just for you to take action. And then we also see in yellow, he even draws the connection to big tobacco. So you'll see, just as big tobacco blocked progress on addressing the harms of smoking, fossil fuel executives and the politicians they own are standing in the way of this opportunity, keeping us stuck using dirty and expensive fossil fuels that make us sick and destabilize our world. And then, like we talked about below, I actually think this second yellow kind of box about fossil fuel executives is actually kind of a hope message, because he talks about how the Clean Air Act, during that time, a lot of fossil fuel companies were saying, we can't do this for the economy. We can't do this. It's going to be horrible for all of us. And then we saw, when we passed the Clean Air Act, we had such better public health. We saw the economy actually thrived. So this is a message of we've done this before, we can do it again. And now let's come together at the end. And they actually posted the comment link in the op-ed, which like never happens. So super exciting to see that. And then this op-ed was so popular that a media station, Up North News is a radio station, came to us afterwards and were like, we want to interview Joel. And in his segment, they picked for their social media, it's only a minute and a half because Instagram limits your time, but they pick the part where he talks about how fossil fuel corporations are blocking this. So I'll just play the first few seconds if it goes.
Confused about where the responsibility lies for climate change. And it's largely with the fossil fuel industry actively pushing against safeguards on pollution that will help us transition to a clean energy economy that will benefit everyone. And the big opportunity that is up right now is
Okay, so after that, he just kind of moves to the call to the action, but you can see how that can be really threaded in, even in a minute-long statement. I wanted to share another one because that was kind of proactive policy. We've also worked on talking about specific fossil fuel projects in our state. So right now we have a subsidy going to a gas plant in Superior, Wisconsin. And so we use a really similar formula here. You have the value statements in blue. We also talk about freedom from outdated fuels a lot because in messaging studies from our state, we know that freedom, trust, and family were the top 3 values that come out. So we know that health professionals have that trust. So we talk about freedom and family a lot as an organization. And then in orange, you have a solution statement. So we talk about the Inflation Reduction Act, bringing this funding. It's available now. We can have better. We don't need to double down on fossil fuels. And then if there's a chance to, if you know that your opponent is talking about a certain, claim, in this case, we knew that they're really trying to scare the community in Superior, that they're going to raise their energy bills. You can also call that out in your message. So in this yellow box here, we have, as Wisconsinites and health advocates, we're tired of seeing our neighbors and patients struggle to choose between paying rising healthcare bills or high electricity bills as fossil fuel prices climb. The fossil fuel industry is making record profits at the expense of our health, and we refuse to bankroll it. We are ready for a brighter future for our families and climate. And so we knew they were talking about the rising bills, so we want to also talk about how fossil fuels rise our bills and how that's not really the whole message. And the response has been really strong. So here's just a quick example. This is a message from the first Indigenous city councilor of Superior, so right on the front lines. And she said, please share that the healthcare professionals got the most interest from neighbors and citizens. This is one of many messages we've gotten from Superior. They've asked us to come back time and time again. In fact, just in a couple of weeks, we'll have community health forums here. This is organized by their city councilors to have health professionals come in because they really thought the message was strong and resonated with what we were saying. They're really concerned about the neurodevelopmental effects, actually. That was the biggest one they asked us to talk about. And so I know it's hard sometimes, these action alerts are multiple paragraphs. Social media, I think, is honestly the trickiest spot to talk about this because you have limited characters on Twitter or X. And so I kind of just put a bunch of examples here. I don't expect to go through all of them with you, but just a couple tricks that we've found is just try switching climate with fossil fuels every once in a while, especially if the article explicitly talks about climate a lot. So we noticed in Wisconsin media that the sites were doing a pretty good job of covering the climate impacts, and they were starting to talk to us, so the health impacts are getting in there, but there's no connection to fossil fuels. So you can add that in your statement about it when you introduce the article on social media, or creating graphics about it, like the one in this top left where we talk about air pollution from the burning of fossil fuels associated with premature birth. So that's the other tip I have for you, is just talk about the direct health impacts of air and water pollution from fossil fuels early and often. We also have one of our prominent messages for signs and protests is fossil fuels make Wisconsinites sick. So people are making that connection every day. Another quick tip for social media is just talk about who profits from this. And this is really important because we've also noticed the more that we're talking about it, the more the media cycle in Wisconsin is also talking about it. So in this top right corner, that's actually a picture. We were dealing with a utility rate increase, and in Wisconsin, some of our utilities have the highest return on equity or profit in the country. They were saying they couldn't have clean energy because it would increase the prices for everybody in town, and it was pitting low-income customers against clean energy. But what we saw is that actually the populations that have the highest energy burden are Black and Latino neighborhoods in our communities, and they also have the most to benefit from the air quality benefits. And it's really the profit going to these other companies, not the clean energy issues that are causing this rise in cost year upon year. So when we talked to the news sites about it and started talking about it more, they actually picked that up and wrote an article about it. And for the first year, our Public Service Commission actually rejected some of those rate increases for the first time ever and cut their return on equity. So it had a huge effect. So once you connect fossil fuels and the health impacts, and once you connect the who is profiting piece of it, then it can be pretty easy to talk about stopping fossil fuel infrastructure buildouts, naming the projects that you're working on, and health professionals are really interested in working on them as well. And so here's just a couple pictures of us working on line 3 and line 5. This is one example on the right. We put out a call to action about the Enbridge pipeline line 5, and in just 2 weeks, we got 180 comments from health professionals. And so a few lessons learned. I don't actually have to talk about a lot of these because they were mentioned in the research. But I think one big one is that we have more and stronger relationships with frontline groups. A lot of our work and where our strongest relationships are fighting some of these fossil fuel projects. And we're really excited to keep growing some of those relationships. And so definitely a great way to grow out that piece of our effort and collaboration. We found that it makes the solutions local. So media is picking up on these issues more because they're seeing the projects in their communities, the fossil fuel impacts in their communities, and they say, this is a Wisconsin issue, not just a global issue. And we've seen it attract new members, quite a few, especially medical students seem to be really interested in our fossil fuel infrastructure work. And then we found it doesn't leave the door open for others to decide the cause or the reason for policy delay. And to date, we've actually received no negative feedback on this. I know you're gonna think I'm lying, but I think it's because we're pairing it with those solutions and some of those other things. And once you're talking about the health impacts of fossil fuels, it's pretty simple to then be, drawing the next connection to why that project in your community is going to be harmful. All right, and we'll open it up for questions. So I'm just going to take one or two because I think we're pretty limited on time, and we do have a workshop later this afternoon where you can dive into it a little bit more. So if people want to step up to the microphone, we'll take a few. Go ahead.
Bear with me, recovering from vacation. So trying to put my thoughts together. So a lot of what at least some of you spoke about was talking about misinformation and lies from fossil fuels. But I'm wondering, in the current political climate where I feel like truth and lies are somewhat politically mediated or like, certainly not as firm of concepts as they've been in the past, compared to the Wisconsin example where it was more about like them being blockers and trying to prevent progress. I'm wondering if somebody, maybe John or someone else, can speak a little bit about, the risks of truth versus lie framing versus other possible ways to describe or characterize the harmful actions of fossil fuels, executives, CEOs, et cetera.
Yeah, it's a good question. I mean, so we know obviously from the research that health professionals are starting from a place of advantage and relative to the fossil fuel industry. But as you note, some of those lies and misinformation may not necessarily always come directly from the fossil fuel industry. It may be conveyed through intermediaries. And I think that's where it's really important for health professionals to draw draw the connections and connect the dots for people between those intermediaries and where those messages are originating. And I think that's also part of where some of the research that Ben presented earlier about just sort of how long the fossil fuel industry has known about these issues and the active efforts they've been engaged in to really sow misinformation and doubt can be really helpful evidence to point to. I don't know if Nick or Rob or Abby, you have.
I have
Other
one
thoughts?
other possible suggestion to this. It's very hard. If you have facts and say, this is what they say they're doing, and here's the reality of what they're doing, that's, you just can counter a misrepresentation or something that's misleading with the truth. Some of the trickier stuff is when they predict the future. Like this, the economy is gonna go to hell, prices are gonna go up, because they're predicting the future. And it's, as I've learned, it's a very hard thing to actually be sure about. But what you can say is, this is I think Linda said something important. This is the old playbook. And to say that, remember when the tobacco companies told us that all of the restaurants and bars were going to go out of business if we wouldn't allow smoking, then the local economies would go to hell and divorce rates would go up. If there was no outlet and no place to send your husband. And remember, none of that came true. None of that came true. That's that way you can say, you can use that story to make the point about, this is an old playbook for scaring the hell out of everybody when it won't happen. Because there's no way to know how to respond. But if there's a fact, here's what they say, here's the truth, you use the fact to counter it.
And I just add, I think, and this first point is maybe wild speculation on my part, but I do feel like doctors as a front line of misinformation probably have more credibility to say this is false information, because there's a lot of false information that doctors have had to deal with in the last few years. I think the other thing, just personally, from the presentation before, the power of showing those reports that Ben showed us, to me, was like super striking. I want screenshots of those as like a really powerful way to like, no, here are the receipts. We don't have to speculate. We have them here.
I have one other, maybe I lost it, but it's about framing. That people have asked me a lot to compare big tobacco and that fight with big oil. And it's not a perfect framing of the equivalence. And I think we have to recognize that big oil is, we had 200 years of fossil fuels that have delivered benefits. We've enjoyed those benefits. So it's probably better to characterize, tobacco was an unnecessary evil, with emphasis on unnecessary. What social benefit did tobacco ever offer? But oil and fossil fuel energy was for a long time, was considered a necessary evil. But now it's a no longer necessary evil. And that's a way to think about it and talk about it, so people don't have to feel as implicated in all of this and say that we're just screaming villain, evil incarnate. We're just saying, look, it's an unnecessary evil. We have a better way now. They're just trying to hang on. So that's why I look at the differences between calling out lying. Yes, you do, but how you frame your what the villain is about is a little different than tobacco.
I just want to add to, I've heard a lot of fears from even some of our members about using some of this messaging at first. But I've also heard the response for the most part is not really, doesn't come down to this like truth versus lie as much as a just extreme reflection on how much they had actually embodied, like taken in those lies and felt like they had been defeated by them. They had really felt guilty for all of the plastic straws and time they drive their car or felt like their community just didn't care enough about climate policy. Like, I'm the only one in this lonely world that seems to care in my community. And when we told them the truth, like, actually, there's a lot of money and lobbying and misinformation and campaigns spent to make you think that others don't care and to delay that policy, it was like giving them hope back and giving them, anger and defiance instead of guilt. And I think we should also think about the framing of, like, for those that are listening, giving them that gift of kind of seeing what we see. Okay.
Should we take one?
Okay, so we're gonna wrap it up. We'll take more questions at the workshop and at the lunch break. And Bev's gonna come on stage and close us out.
We're sorry we don't have more time for
Let's do
questions.
one more time for our meeting. Those were such good sessions, really a great way to start us off here. Two quick logistical points. We've gotten a lot of questions about slides. They will be available after the meeting, so you can go back and reference and see all the great information that was shared. And CME info will be emailed to you after the meeting. So we got CME accreditation for like all of this year, wildly. So really great. And obviously this conversation is going to continue at the workshop this afternoon. We hope it continues and you use the guide, the messaging guide. I'm picturing next year we have a beautiful compilation of all of the op-eds and interviews that are using this messaging, and it's gonna be a great slide. And then also that you come join the Fossil Free for Health Coalition and help us make this work happen. So I was just thinking, like, what do we have in this room that the fossil fuel industry does not have? We have the truth. We have that on our side. We have the trust of the public and their support. We have really deep love for patients and communities, really deep and powerful care. We have each other. And then one thing we also have is musical and creative talent. And this work it's hard work, and it's like really serious and dire stuff we're working against here, but it need not be grim. And this work can be so joyful. And we wanted to end these sessions with a little bit of that joy.
Alrighty, so without much further ado, we're going to bring some joy into the room that is brought to you via Linda Rudolph, who I think many people in this room have the pleasure of knowing. She has personally been a mentor and a hero of mine for many years. But one thing you might not know about Linda is that she is musical and has written many songs and wrote this song. So here we go.
We have a couple more slides in between.
What?
The little extra slides.
Okay.
We're tired of seeing our patients and community get sick from all the pollution that you make them breathe. You told us lies you can't deny, you did us wrong, but now we're strong. And fossil fuels must now be gone, we must act fast to save our lives. We've got to kick those fossil fuels to keep the world at 1.5. Tell the truth about fossil fuels, make polluters pay their share. No more drilling, no more flaring, you know we all need clean air. It's time to go, time to phase out. Fossil free for health is in our reach, we have no doubt. Weren't you the ones who lied, the science you denied? We're health professionals, and your harms we will defy. We're speaking out so we survive. Stop burning oil and gas and coal to save 8 million of our lives. We can all go fossil free, we can bend iniquities, and we will thrive, we will survive. Hey, hey.